Hello, my name is Brendan Roberts. I would like to speak with you today about a very important subject called hypoglycemia. And I'll just read quickly what are the symptoms of hypoglycemia. Craving sweets during the day, irritability if meals are missed, depending on coffee to keep oneself up or going, getting lightheaded if meals are missed, and then when you eat, the eating will relieve fatigue. When you're hypoglycemic, one will feel shaky, jittery, and tremors, agitated, easily upset, nervous. It'll affect the memory, it'll affect the vision, and also a person will not be able to stay asleep. Now, there's a very important mechanism, simple, super important, that should be understood. The brain needs three things to survive. It needs oxygen, it needs glucose, and it needs stimulation. Hypoglycemia is when the brain does not have enough glucose. The jitteriness, the shaking, the tremors, the irritability, all of that comes because when the adrenal glands are deficient, there's not enough cortisol to regulate the glucose getting to the brain. So the body secretes adrenaline. When adrenaline is secreted to produce the what we call glyconeogenesis, then a person is going to have those symptoms. Another really, the reason that a person will wake up at night is because if there's not enough glucose to keep a person asleep and regulating the neurologic functions, again, the adrenal glands are going to secrete adrenaline because there's insufficient glucose, and then a person is going to be awake because basically they're in an adrenaline surge. Now, hypoglycemia is really common because people are largely addicted to caffeine and sugar, and white flour, pasta, breads, cupcakes, muffins, pancakes, etc., etc. The American diet kind of leans one towards hypoglycemia, and it's really, really important condition to have remedied, because what very few people know is that when one is in a hyperglycemic state, they are losing brain cells. And brain cells do not grow back. When you have lost these neurons, they are gone forever. It's kind of similar where someone is drowning. You rescue them, but if there is neurologic damage, those cells are gone. And as we age, we want to make sure that we are not losing any more brain cells, because naturally that's happening with the aging process. So hypoglycemia is when there is not enough blood sugar, there's not enough glucose in the brain. Now, what the body does is it, through a very complicated process called glyconeogenesis, it takes stored fat and protein and it metabolizes it and turns it into glucose for the brain. Now, in order for that to happen, a person has to have healthy adrenal glands, a highly functioning liver, and a healthy pancreas, with all of that being regulated by the hypothalamus, which is the regulative mechanism in the brain. So with hypoglycemia, what I do in my practice is I look at these foundational mechanisms and to see where there may be an issue, and then to sort of support that, and of course give some lifestyle and dietary recommendations. Thanks for listening.